Last summer, 4 members of Fatu Kekula's family were infected with Ebola. Fatu was a nursing student in Liberia, and she courageously cared for her family, directly putting her own life at risk. She successfully cared for her mother, father, and sister. Her cousin died from the illness. Yet the 75% survival rate for her patients is far better than many hospitals in the region, and her method of improvised protective gear has been taught to others who don't have access to proper equipment. We're honored to have Fatu join us for our conversation today about the future of global health after Ebola. Tell us about your experience of studying nursing in Liberia.
Well, my experience of studying nursing back in Liberia is interesting, but we don't have the facilities as compared to developed countries, like a laboratory where students go and do practicals. We don't have it available for us, so that makes it at times difficult to grab the lesson that the instructor is teaching very fast, because most people learn different ways. Some people learn by touching, by feeling, and then if you have a student that learns by touching and feeling, and then you don't have the materials to show the students what they should touch and feel, it becomes difficult for that individual to cope with the lesson.
So when you were studying nursing in Liberia and the Ebola epidemic began, did you see Ebola in your clinical practice?
I saw Ebola patients, but it was not in facility, it was at my home. That was my father, mother, sister, and my little cousin.
So you were very inventive in the things that you used to care for your family members. You used trash bags and raincoats. How did you come up with those ideas?
Well, those ideas came up because for us, mostly in Liberia, our instructors tell us to learn how to improvise because of our sector. We don't have all of the equipment that we need to care for patients. And then though the equipment is not there, but what are those other things as a nurse? That is the critical thinking. What will you do to keep your patient stable? So that was how that idea came to me, because I have seen your PPE. It's like a plastic, but I didn't have the means of getting them. So I decided to use the plastic in place of the PPE.
That's so impressive. And we know with Ebola cases how important it is for people to stay hydrated. What can you share with us about how you tried to keep your family members hydrated?
During the time of their illness, I established Afilan. On the 4 of them, I was giving them fluid, like the NS, the Nomocelan. I was giving them ringer lactate. I was giving them the oral rehydration salt, giving them coconut water, liquid safe, any fluid for that matter. Those were the things I was feeding them with.
Wonderful. So both your mother and father have recovered. How are they doing now?
Yeah, my mom, my father, my older sister, they all recovered and they are doing fine.
Yeah. And what does your community think of the way that you took care of your family? And they must be very proud of you.
Yeah, they are very proud of me. Say they admire what I did, and not just my community, but the whole nation.
Absolutely, yeah. So after Ebola arrived, your nursing school was closed, and you've come here to Emory to study. What have you learned here, and what will you bring back to Liberia?
For here, I have learned new skills, and I have learned how to do it myself, like doing practical on the mannequins and everything. My instructor taught me the perfect way of giving injection, all of those ones. Because at first, so I used to inject, but the method that she showed me, I believe that is very good, because that's one of our problems back home, the sites to give the medication. So at the end of the day, you found out that most of the patients come down with upset and things. But I believe that what she taught me, in that manner, I'm going to take it back.
So how does it compare studying nursing here in the United States to studying in your home country? What are the differences that you see?
Yeah, the difference is that for here, everything that the instructor would tell you, you will see it and you would perform it before you can be taken at a hospital to do your practical on a living being.
And now your nursing school has reopened, correct?
Yeah.
Yeah. So what are your plans when you return to Liberia in your home?
My plans, if I return back to Liberia, I would like to help my colleagues, the girls, in education, especially those girls that are vulnerable. They don't have the means of educating themselves. I would like, because before I could come here, I did establish an NGO on my own, and my intention is to help the orphans who their parent has died because of the crisis. They are unable to go to school. So I want to look at that direction, and also girls' education. The youth need to be educated, because once you are educated, and then if a circumstance like this come, you will know what to do. Like for a typical example, during the time Ebola broke up in March, people never had an idea of the virus. So I believe that was how the virus spread. Yeah, because of the lack of knowledge.
Well, I think the girls in Liberia have a wonderful role model in you to look up to. If there was one thing that you wanted people all over the world to know about Ebola, what would you share?
I would like for them to know that Ebola is real, it exists, and they should know the preventive measures for Ebola, because that's the only way we can get rid of Ebola, to follow the proper preventive measures, because there is no cure and there is no treatment of the virus. So what an individual can do is to best do their preventive measures.
What do you think the future will be like in Liberia when you go home?
Well, the future of Liberia right now, because of the virus, most of the activities like the economic status, education, health, all have been broken down. Like, we've come to health workers and things. At first, we were already suffering from low health worker service, and then Ebola came and took almost 50% of the health worker that we had. So that's one of the main things. So people in that country should be encouraged to get in the health sector, because a healthy nation is capable of doing good things.
Well, I want to thank you so much, Fatou. I'm so impressed by your courage and inspired, and I think that the students that are taking our course will be too. So thank you for sharing with us.
Thank you.